Health and Policies in South Australia has positioned itself slightly differently to other health and policies approaches that I'm aware of in some of the international communities. Our approach is that we've started very purposefully on, with a focus on the social determinants of health. So the entry point for South Australia is to work and influence the social determinants of health, which means we work on the policies of other sectors. We put other sectors' priorities as our priority and work to help them achieve their goals. And in so doing, we then ultimately achieve our goals, which is to have improved determinants distributed more effectively and evenly across our population. We focus, and in doing this, we focus on co-benefits and co-design. So we work with our partner agencies, the other sectors that we're working with on particular policy issues, right from the beginning. So as they try to unpack their policy problem, we work with them to get a shared understanding of what the issues are. We explore what's the best way of approaching it. We do shared learning, and we come to a point where we can see how we might both benefit from taking steps forward. We have a methodology or a series of methodologies that help us guide in this co-design process. Historically, we've used health lens analysis, which has been very focused on a project approach, where we've identified working with the co-design process with our partners on what a policy issue is, mapping out the evidence, and then determining a set of steps forward, how we would go to talk to partners, what stakeholders we would engage with, what research we would do, generating a number of recommendations, and then importantly navigating those recommendations through the political process, making sure that all of the partners, decision makers, were comfortable and happy with the outcomes and signed off and endorsed it. We also now more recently use public health partner authorities, which is a mechanism contained within our Public Health Act. These partners work with us collaboratively on areas of mutual interest that will improve health and wellbeing outcomes. Instead of a project proposal and a project process, we really have we develop an MOU, a Memorandum of Understanding with these partners, where we document our areas of interest over a period of time, say 5 years. And we may have specific tangible deliverables in those MOUs, but we also have areas of just mutual interest that we're going to work together on in an ongoing way. So that allows for new emerging issues to arise over time. The benefit of the MOU is it sets up an ongoing governance structure, a high-level governance structure with between each of the parties, between the Health Department and the other partnering agencies, say the Planning Department or the Environment Department, where our decision makers are actually learning and understanding about our processes and can see the benefits of working together. Lastly, the thing that I want to say that's perhaps different about our approach is we also focus on sharing the benefits. So when there is a good outcome, we make sure that not just the health minister or the health chief executive gets up to do the launch, we also want the planning chief executive or the environment chief executive and minister doing the launch, so that both these ministerial parties can see the benefits, so it's shared benefit. The underpinning approach for our work here is that we're looking both to set up horizontal collaborative relationships across government, but at the same time support and not undermine the natural vertical silo structures of our political government process. So we work to keep the chief executives informed, comfortable and approving what we're doing, but at the same time working very strongly on a collaborative partnership process across government. So we really tie the vertical and horizontal governance mechanisms together. People often ask me about money, and I think there's been a sense that you need to have money to be able to engage collaboratively with other parts of government. But we don't. We don't have hardly any money. I have a very small budget. What we do offer other agencies is we offer our skills and our time. I have a team of about 5 people, and we bring their skills and resources to the partnership. We expect our partners to match that. So we expect them to provide time. We want policy officers to work with us so that we get a shared dialogue, so that we can have shared learnings and we can work collaboratively on the issue and the policy agenda together. Occasionally, when it's required to have a better understanding of the circumstances of the policy issue, we might undertake a piece of research. And so we might offer a very small amount of money to commission some research, maybe $5,000, $10,000 in Australian terms. We then expect our partners to match that. So it's a shared responsibility, it's a shared cost. And of course, when they match that, they then have shared influence over what are the questions and the research design that is occurring. And so we don't find that money is helpful, really. Lots of money, I think it just gets in the way. It's really about the collaborative relationship, which is about people. People are the most important things. And if we can get the policy environment right and the policy context right, then sometimes we will require services on the ground. But that's not really what Health and Policies is about. Health and Policies is about creating the right policy environment, and then hopefully the services will follow. And that's not, so our approach is not really about money.